All right, looks like we're ready. We'll go ahead and start the recording. Awesome. Well, welcome everyone. Welcome to the Match Coalition December meeting. We are so honored to have you. As a reminder, the Match Coalition, MATCH stands for the Maternal Applications Technology for Community Health. We have an amazing program today, and I want to first acknowledge Kelsey Williams, who is the Match Coalition coordinator in helping us to get all the logistics in place for today's meeting. We've got a packed agenda that I'm just like, again, so thrilled for. Number one, we're going to talk just very briefly about our goals and objectives for the coming year, because 2025 is just upon us. I think we're going to turn the corner in a week or so, 2 weeks. We'll be there. We're also going to give you a little snapshot of the top 5 priority areas from our Match Coalition participants. And if you haven't participated in that survey, we're going to drop the link for that into the window as well, so you can provide your insights. And then we are going to very quickly move it over to today's guest speakers and panel. And we're really excited to be able to kind of appreciate where we have been in 2024. And as I like to say, conservatively, optimistically look towards the future and what 2025 and beyond has for us. Just being behind the scenes as part of the sausage making, I was already able to hear some of our panelists talk about lots of commotion that's happening on the Hill and elsewhere. So I'm excited to be able to, for all of us to be able to share in on that conversation and knowledge in just a few moments during David's moderation of today's panel. So without further ado, I'm just going to really quickly highlight for everyone our 2025 goals and objectives. This is not a final list. I'm bringing this very quickly to your attention because we want to make sure that everyone who has any thoughts or insights they'd like to make sure get reflected in where the direction of where we're going with our objectives, as well as with our focus on activities in education, technology, and research, that those perspectives and suggestions are heard. And of course, if deemed appropriate, incorporated into the goals and objectives for the coming year. I'm proud to say that our members of our steering committee have actively participated in providing feedback, but there's always room for more. And so we're going to open it up to you to provide that feedback as well. If you did not receive a message from Kelsey and would like to be able to take a look and provide us with feedback, Kelsey is going to provide you with information, a direct link to this document in the chat window, so that you'll have the opportunity to email back to us your thoughts and perspectives on what we might want to consider, again, in terms of our direction for next year. But I think it's quite has been pretty consistent year over year for the last couple of years that our primary goal has been of the Match Coalition to inform key stakeholders and promote related policy, guidelines, and regulations that support the adoption and application of clinically appropriate technology for the betterment of antenatal, perinatal, and postpartum care outcomes by fostering activities in the areas of research, education, and innovation. And all of those, of course, directly influencing public policy as well. Does anyone have any questions or comments about the draft document, again, that is made available for public comment before we publish these in January? We will represent the final draft, if you will, in January, and they will be adopted in January of 2025. But any questions or comments before we move on to our next item on the agenda? All right, thank you for that. And now what I'd love to be able to drop into the window for everybody are the initial results, the preliminary results of our question. We put out one question the last couple of years to all of our participants, and that is, what are your priority areas for the coming year? So no surprise, this year the question was, what are your priority areas for 2025? We use this information to help drive the program and the speakers and content that we put forth. And with that, for this year, we've got listed in, I've actually dropped it into the chat window for everyone. Um, we've listed the top 5 as participation and advocacy on maternal health federal initiatives was the number 1. Number 2, learn about community-based organizations. So love the idea of bringing that back. I think we had a couple of years where we really did a spotlight on some of the local and national CBOs out there. So we're excited to bring that forth again. More in-depth policy analysis. Well, we're already going to be kicking that off today. So I'm really excited to be able to hear from our panel. And then number 4, learn about innovations in companies. We will look to do more of what we did this year, which was our showcase. We had a phenomenal 2-day showcase, and I'm glad to see that folks still find much value in that. Maybe in the near future, we can move towards the creation of a resource or directory listing out those corporations. And then number 5, grant opportunities and successful grant submissions. I know in past years we've had Earl Rugg, who's participated with us. He's a serial HRSA grant winning writer. And there are many more like himself that are out there. So we will work very diligently to bring them and others to this forum to share insights. I think those are some phenomenal areas. David, are you surprised by this list? He's like, nope, not at all.
Oh, but they all sound great, really exciting. Looking forward to it. I think next year's gonna be good.
I do as well. I think it's going to be an awesome year. So I know you didn't ask, but I'm going to share with everyone, how is Fran going to be kicking off 2025? Well, like I do every year, and that is going to be at CES. The Consumer Electronics Show is in January, kicks off on January the 7th. I love the digital health track. It brings in a whole host of programs and really keeps me informed on where things are going, what, not only what some of the trends are, but the new trends that are to be set. And I also love to see us as a place to, quite frankly, just go and look at everything that's non-health related and other aspects so that I can find areas where we can apply innovation. So I hope you have something also outlined for your 2025. If anyone has any events that they'd like to bring forth right now, is your chance, your opportunity. You can drop those event informations either in the chat window or raise your digital hand or come onto the camera and share that information with us. Does anybody have any events that they'd like to announce that they've got going on, either locally, regionally, or nationally? All right. Well, I hope to see some of you well, I know I'm going to see you, Catherine, at the, at the, um, at the Consumer Electronics Show, and I hope to see many others. So with that, those are all of our updates and announcements for today. And without further ado, it is my distinguished pleasure and honor to hand it over to my co-chair, David Gray from HIMSS. David?
Thanks, Fran, and hi everyone. Happy Tuesday. I almost said happy Friday. No, just wishful thinking on my part. Um, happy Tuesday. Thank you all for joining us. I'm really excited for the conversation we're about to have looking at next year and beyond. We'll have a new Congress, a new administration, all new figures throughout Washington, D.C. A lot of challenges and a lot of opportunities, especially in the maternal health space that we're going to talk about. First, so I'm David Gray, Director of Government Relations at HIMSS and one of the co-chairs of the Match Coalition. And let me just introduce the others. We have Elizabeth Frazee, who is the co-founder and CEO of Twin Logic Strategies and Match co-chair emeritus. Ariel Gonzalez is the principal and head of healthcare practice at the Vogel Group. And Catherine Pugh is the Director of Digital Health with the Consumer Technology Association, or CTA. All of you, thank you for joining us. You're all experts and really excited for the conversation and to hear your insights and your prognostications about what we can expect um, as we head into next year, as we were talking about earlier. But before we do talk about sort of what we can expect, or we're hoping for, what we are fearful of, I just want to start off by talking a little bit about what, looking back at the last year, 2 years, what were some of the things that you were all proud of that we saw accomplished, and then or what is a big missed opportunity from this last Congress, the 118th Congress? Um, Whoever would like to start off, or I can share mine if anyone wants to go first.
Well, I would just say, David, that jury's still out, right?
Sure.
Because we are waiting with bated breath to see the language in the short-term funding bill, the continuing resolution that is coming out any moment now. Speaker Johnson has said, while he wanted it to be a very narrow bill, it's grown, and some members are calling it a Christmas tree, but it is going to contain healthcare provisions. We've heard some of them listed. We haven't seen the detailed language. So we're still waiting. I'd say it's too early to say.
Yeah, that's a good point. Ariel or Catherine, something that you, over the last year or two, that has resonated with you, stuck with you, either in a good way or a bad way?
I think Congress, this past Congress, well, they have done not enough, right, on a lot of areas, a lot of different public policy areas. One thing I am sort of hopeful for in terms of moving forward for next Congress, and sort of happy that Congress has looked at it in terms of this Congress, has been the area also of maternal mental health, and really being able to sort of link issues in mental health with maternity care, right? And sort of creating the TLC Mama hotline, providing funding for that to get that off the ground, and Congress sort of beginning to recognize, the linking of our maternal health issues in this country with also the mental health aspects. So that is something that I do think, Congress began to look at this year, and hopefully they'll continue to focus on within the next session as well.
Catherine, anything else to add?
Yeah, just, weighing in on the agency side, this past week, we just saw the FCC released the 2024 Mapping Broadband Health in America. And this includes new maternal health, opioids, chronic disease, and social determinants of health metrics, which some of that was included in the Data Mapping to Save Moms' Lives Act that was passed in 2022. And the goal of that was really to see where areas of poor maternal health outcomes overlap with the lack of access to broadband services. So telehealth services can be more pinpointed and effective in these areas. Coupling that with what Elizabeth was talking about, hopefully we'll see not only the 2-year extension of the Medicare telehealth flexibilities, excuse me. We also will hopefully see a 2-year extension of the telehealth flexibilities that allow for $0 telehealth coverage for those on high deductible health plans, which is a growing number of people across America. So that means that your telehealth visits could be covered, if you're on a high deductible health plan, can be covered at $0. So you don't have to meet fully covered at $0. So you don't have to meet your deductible before those are covered. So hopefully that's also included in the year-end bill, and that it passes by Friday. But looking forward in what we've seen, you said good, bad, of course, elephant in the room, post-Dobbs decision, but kind of flipping that, we did see a large growth in demand for telehealth services post Dobbs decision. So I do expect to see that to continue. And, you know, the policies there that we're working on here only support that moving forward.
Thanks for that. Yeah. And from my perspective, you know, I think one of the really positive things that we have seen over the last couple of years, you know, that this group has talked about is coverage. Right now, 46 states have 12-month postpartum coverage. For Medicaid, 2 states, Iowa and Idaho, I believe, are in the process of implementing 12 months. And then Wisconsin and Arkansas still have to get their act together. But, you know, we've seen a lot of progress toward that 12-month postpartum coverage. And from, you know, a missed opportunity standpoint, the Affordable Connectivity Program, this is the broadband subsidy program that was enacted at the beginning in response to COVID, that ran out of funding in June. There is, you know, a lot of bipartisan support for it in Congress. There just hasn't been the political will to get that program funded. And then, you know, a number of really positive maternal health, bipartisan, bicameral maternal health bills that, you know, will expire on December 31st that will likely not see action before then. But gives us an opportunity heading into next year to really rally around some of those bills. Like, I know we're going to talk about it later, but the reauthorization of the Preventing Maternal Deaths Act, which provides funding for maternal mortality review committees. This is a bill that passed out of the House. It moved out of the Senate committee. The lead sponsor, Dr. Burgess, who's retiring at the end of the year, it's just kind of languishing out there, waiting for movement that probably won't happen. A lot of missed opportunities, but definitely some positive takeaways from the last year. So, you know, looking ahead to next Congress, the November elections are a month and a half. We're a month and a half away from the November elections. The dust is sort of settled. We have a very clear picture of what power will look like in DC. You know, Elizabeth, that's sort of a 3-part question for you to kick us off. You know, can you give us a quick rundown of what the congressional makeup will be heading into next year? What sort of we can expect Congress to focus on very early in the first few months of 2025. And then on top of that, what are some of the challenges or realities that the House and Senate Republican leadership will face in implementing both their priorities as well as the new incoming president's priorities? I know that was a lot, but I can ask those again.
That was a lot, David. And I could take a long time to cover it, but let me try to be brief. So the makeup, of course, is we've got a GOP trifecta. There are 53 members, 53 Republican senators, 47 Dems. Some seats were flipped in the Senate. And that, of course, means we've got new chairmen of the committees that control healthcare policy. So the Health Committee and the Senate Finance Committee. And, you know, new members holding the gavel, they're going to have some new ideas. They want to leave their mark on policy. In the House, the ratios are 120 to 115 today, or starting January 3rd, when the House is sworn in. But those numbers are going to quickly decline on the Republican side because President-elect Trump has poached some House members who are going into the administration. So they're going to be down 3 members. That includes Matt Gaetz, of course, who resigned from Congress after he pulled his nomination for Attorney General. So that's going to be a very narrow margin in the House, and it's going to make things very challenging for Republican leadership to get anything done. What Congress plans to focus on are taxes, energy, and border, and amongst some other things. And of course, when you're talking about tax policy, there will be pay-fors for tax cuts. With those pay-fors, we don't know what the future holds for, and sorry about that, it's a busy time, what the future holds for some of the Medicaid programs, and I think everything is in the line of sight of the Trump administration to find ways to pay for tax cuts that the president-elect wants. And the beauty of reconciliation, which is how they're going to do all this, is that it only requires a simple majority in the Senate. So they have to have 51 senators support it. And that is only can relate to budget and tax provisions. There's a process called the bird bath that we can talk about later. But just the margins are slim. It's going to be tough. And those senators who are moderates are going to be the ones that everyone is focusing on right now to try to turn them. Did I answer all your questions?
Yeah, I mean, do you mind going into a little bit about some of the, obviously nominations are going to be a big chunk of time as well. And, the news that we heard this morning is on the funding report is kicking funding into March, meaning it's going to be a very busy 3 months for the new Congress. Can you just briefly, you mentioned reconciliation. What are some of the other sort of vehicles like the Congressional Review Act that Congress has in their pocket, the new Republican-controlled Congress that they can use to their advantage?
It's a great question. All of the committee staff right now on the Republican side are putting together a list of the regulations that the Biden administration has done in the last 60 days. And they are, as we were talking before the call, Catherine was saying that rules are coming out, and all of those rules could potentially be repealed under the Congressional Review Act. It's just another tool in Congress's toolkit. I don't have a crystal ball to what rules will be appealed, but industry and interest groups are going to be very active in pointing out to Congress what they should attack.
Ariel, Catherine, anything to add? It seems like for better or worse, healthcare will largely sort of take a back seat, at least early in 2025, except as it relates to, as you mentioned, pay-fors for any budget reconciliation. Do you have any sort of similar readings or different takes on what we can expect?
Yeah, I think the one area where I'm hearing there will be health in the mix in early 2025 and directly impacting maternal health is Medicaid reform. So, I've heard that for the most part, Republicans aren't considering any Medicare reforms as a part of their budget reconciliation process. However, they are targeting Medicaid for the budget reconciliation process. As Elizabeth mentioned, there are really tight margins right now, which is why the reconciliation process is so attractive. But a lot of these reforms could, especially if they're doing block grants, things like that, they could be savers. And so it becomes, an even more likely scenario that you're seeing some large scale Medicaid reforms early in 2025.
Yeah, totally agree. I mean, there's various parts of the Medicaid program that are definitely being discussed and under attack. And Congressional Republicans have sort of revealed this playbook, in the past, as Catherine mentioned, looking at, block grants, per capita caps. I also think, they're going to look at, approving waivers for states that require things like work requirements. We saw that in sort of Trump 1, and it may be, revisited this time around as well as, sort of more frequent eligibility checks for Medicaid enrollees. Just, finding ways to, identify savings in the Medicaid program, and totally agree. I think Republicans are not really looking at Medicare because it's such a hot button issue for, a huge segment of voters. But Medicaid, I think, and Medicaid reforms will definitely be on the table potentially early in 2025.
Yeah, and the last thing I'll add, we're also going to see a big change in sort of the makeup of a lot of the committees of jurisdiction. either because of retirements or results of the election, the energy, especially the Energy and Commerce Committee and the Finance Committee, there's going to be a ton of turnover. A lot of, longtime healthcare champions, maternal health champions, are retiring, and we're going to see a lot of new faces on those committees, that will have to, that may or may not have a ton of background in healthcare. Gives us an opportunity to educate and to advocate, and keep us busy, as sort of the other stuff, at the leadership level, takes a lot of time at the beginning of next year. I think there are going to be, seven or eight or nine new Democrats on the Finance Committee, alone. And then, the new chair of the Energy and Commerce Committee, as well as a lot of the, physician leaders that have been on Energy and Commerce, announcing their retirement. So a lot of opportunities for us and for the Match Coalition, and healthcare stakeholders to get in early and educate, share our priorities, and see where we can make positive impact.
And we're likely to have we will have a new chair of the Health Subcommittee on Energy and Commerce. Right now, it's a three-way race, and we'll wait and see who the new chairman, Brett Guthrie, decides to appoint.
Yep. Brett Guthrie is the
Full committee.
outgoing health subcommittee chairman who was just elected to the full committee. So switching away from Congress for a little bit, focusing on the administration for next year. Ariel or Catherine, we have a long list of nominees from President Trump for the top positions across HHS. I think we all know some of the big names like RFK Jr. for HHS secretary, but based on you're looking around, do any of them have any sort of background or interest in maternal health or digital health? And more broadly, I have my thoughts, but is there sort of a common theme or high level takeaway that you've noticed from the slate of nominations? What is a Trump 2.0 administration looking to accomplish with some of these names, or collectively all of these names? If anyone has any thoughts.
Yeah, I think you're looking at disruptors, right? Folks who are being put in charge of agencies, or being looked at to be put in charge of agencies to shake things up. Folks who have come out and have said they want to reform these agencies, they want to do away with certain key components. In the healthcare space, obviously, we have RFK Jr., who is being looked at to head up HHS, making the rounds on the Hill this week. With Republican senators, there are some folks who obviously have concerns with some of his statements. In the maternal healthcare space, you look at things around vaccines. There's been potentially controversial statements around the polio vaccine, other vaccines, trying to link vaccines to autism, obviously, which does put a pause in senators on both sides of the aisle. I think the theme that we're seeing, at least on the healthcare side, with RFK Jr., Dr. Marty Makary for FDA and Dr. Oz for CMS, is the idea that we continue to look at preventative medicine is going to be emerging. And I think, we can look at policy proposals in the digital health space, moving forward, as well as the maternal healthcare space, that overlap that help to address preventive medicine to prevent chronic diseases. From an advocacy perspective, I think, a way that advocacy groups, companies, organizations, if they can package, sort of their policy arguments in a way that looks to address things like chronic diseases through preventative care, I think that will resonate pretty far with the slate of nominees, that we're looking at so far in the healthcare space.
Yeah, absolutely agree. And then, we're seeing a lot of disruptors from the digital health space. We've been, fairly bipartisan issue, really supported across both aisles. And just looking at Dr. Oz specifically, if he's confirmed as the CMS administrator, he does have a lot of background in the digital health space. I know he's attended CES a few times. So I expect he'll be a big supporter of digital health. Of course, to be determined, but based on companies he's been involved with, I think digital health is well positioned.
Yeah. And I think disruption is definitely a great word. I think disruption, efficiency, with the DOGE, Department of Government Efficiency, I think that is a term we're going to be hearing and seeing a lot over the next couple of years. So I guess, switching gears a little bit, Catherine, Ariel, Elizabeth, can you give a little refresher on, I know you mentioned one of the bills already, but President Trump was first in office 2017 to 2021. Can you talk a little bit about some of the things that were accomplished, bills that were signed into law, regulations that were promulgated, that, have sort of set the scene over the last 4 years, something that we can look back on that could potentially be a roadmap as much as, his first term is a roadmap for a second term, that we can look at?
Yeah, I'm happy to jump in on a couple of issues. A couple of things specific that we saw to maternal health. President Trump did sign the Preventing Maternal Deaths Act of 2018. It provided funding to help improve state models to collect data on pregnant and created improved data on maternal health outcomes. The administration also implemented the maternal opioid misuse model to improve care for pregnant and postpartum women with opioid use disorder. And then outside of, specific to maternal health, we were talking, before we started this call about ONC and data sharing. And if folks remember, the information blocking regulations were rolled out under the first Trump administration. And that was really focused on empowering consumers with their own data. And I can see that continuing to be a focus because it was a really high priority for the first Trump administration. And, as someone who did work on lobbying and in helping draft the 21st Century Cures Act when we were originally working that through Congress, that I don't think that was ever like a big intent of the law as drafted. And so it was really the administration that took it that extra step to talk about how to really use what was written in statute to empower consumers to access their health data. And then also, not specific to maternal health, but specific to digital health. Trump in the early days of the COVID pandemic did issue an executive order on improving rural health and telehealth. And then so that's kind of what we've seen. Again, like digital health, a really good example of bipartisan support.
And a lot of the remote patient monitoring in Medicare was also as a Medicare benefit was rolled out during his time in office as well.
Yes, exactly. And I think we'll see that continue to be a focus of the administration in Congress next year. CTA in February helped launch the Congressional Digital Health Caucus, which is led by Congressman Troy Balderson, a Republican from Ohio, and Congresswoman Robin Kelly, Democrat from Illinois. And we've been discussing all of our, focuses for 2025 and really excited about, continuing to focus on remote monitoring, telehealth, AI, and, I know Congresswoman Kelly in particular is really passionate around maternal health.
Yeah, we're halfway through the conversation, and this is the first time I've heard AI mentioned. I think based on which is surprising in the healthcare space. Based on, who the president has surrounded himself with, I think AI is going to be a really big focus throughout government, throughout all sectors over the next couple of years. Um, it's still a very new and scary and optimistic, hopeful space in healthcare. A lot of challenges and opportunities. Can anyone talk a little bit about sort of where they see AI regulation or AI oversight, or lack thereof, sort of playing in a Trump 2.0 administration?
Sure, I can take that on, and then others can jump in to talk specifically about healthcare. But generally, the last Congress spent so much time trying to focus on AI. There were 10 bills that were teed up in the Senate Commerce Committee that are ripe for passage, but they all were just nibbling around the margins of AI, trying to put some guardrails up around the systems and the models. We then found that the House GOP decided they did not want any type of overreaching AI legislation to get in the way of innovation. I think that is a message that we are going to hear consistently from both House and Senate leadership now and the White House. And when you look at the fact that Trump has appointed an AI and crypto czar who is going to sit in the White House, former PayPal exec David Sachs, you can see the emphasis that is going to be put on AI. But I think you're absolutely right, David, that it's going to be focused on the disruptive factor of AI rather than trying to control it. I think this administration sees the promise as opposed to seeing all the scary outcomes. Obviously, there are going to be factors that mean policymakers have to focus on both. But from the beginning, it's going to be focused on what AI can do to innovate in the healthcare area.
Yeah, and the House AI Task Force just came out sort of off the presses with their 273-page report as to their findings as to the promise, as is mentioned of AI, as well as some of the safety concern and guardrails, and it'll be interesting to see if the task force continues moving forward into this next iteration. As was mentioned, congressional Republicans sort of really having the mindset of not wanting to regulate AI and sort of capture the promise. Well, there have been some others who have expressed concerns about how quickly AI is developing, how AGI is developing, and trying to figure out what commonplace guardrails can be instituted, whether it's in healthcare or defense or energy, for example. So it'll be really interesting to see what happens, with the task force, moving forward into the next Congress.
Yeah, that's funny. I just put the link here in the chat to the report. I haven't had a chance to look through it yet. I just pulled it up to the healthcare section and have to look through it, but I completely agree. It's AI is such a strange issue, and like tech policy overall, because my background is like very health focused, and now I'm at a tech the largest tech trade association in North America, and so I kind of have this very interesting view of like health tech, but also tech overall, and it's just it's a strange issue that both Republicans and Democrats are really attacking big tech right now. But then we also have a lot of support for AI and innovation in tech and AI and kind of this like loose touch approach around AI. I think AI in healthcare was well positioned. I say this all the time. Regulation in healthcare is not new. A risk-based approach to regulation in healthcare is not new. It's very the sector is very comfortable with this type of regulation. I think where I'm going to keep an eye on next year is privacy legislation. Can something actually get done? I am skeptical that it can actually get done, but it does impact health. You know, we do have HIPAA, but a large amount of data now is outside of the HIPAA structure. That certainly will impact AI as well. There's a privacy section in this report I saw. And so privacy is another issue where like you've got Republicans and Democrats on both sides agreeing on different issues and disagreeing on separate issues. It's a weird time. And so what I will say on both of those things is that TBD on what's going to happen in Congress, but I know states are going to be very active next year on both issues, AI and privacy. So keep an eye on the states.
I think really quickly, just one area where in conversations I've had on AI issues and guardrails, while they congressional Republicans are constantly saying we don't want to overregulate or regulate this or stifle innovation. One of the areas where they do seem to have interest, and it does align with sort of some of the policies that Trump is beginning to speak about as it relates to tariffs and other things, is keeping our competitive edge, right, over China and sort of other places. So to the extent where there are AI policies to sort of prevent China from receiving certain technologies or software export controls or other things, those are things that will definitely be, I think, on the table moving forward. If it's in the context of beat China, it seems to be on the table as opposed to viewing it as overregulation. So that may be like one area in particular where there may be some ground to move forward.
I would agree with that. And going back to the privacy discussion, I think it's going to be really interesting to see how Senator Cruz, who is now chair of the Senate Commerce Committee and no friend of private rights of action, is going to be able to find a compromise on privacy with Maria Cantwell, who's former chair or current chair of Senate Commerce. Of course, she is a liberal lawmaker from Washington State. So if they can bridge that divide, then maybe there is a hope for privacy legislation in the future. But we've been working to try to address privacy for decades. And actually, perhaps the technology is moving ahead and we're moving toward privacy protection mechanisms that will just become the norm as opposed to needing a federal standard. Not that a federal standard isn't important.
Those are all great points. Yeah, AI, I think it's one of the most we'll be looking at 100 years from now how the policy discussions around AI took place between, what different groups are saying different things. I know, Democrats and Republicans, you have both parties in both camps. Some want unlimited, AI. How can AI replace doctors versus like we need to make sure that AI doesn't replace doctors. And it's just going to be a fascinating case study. Who knows where the technology will be in 100 years, but I know that from HIMSS perspective, we put out our policy principles, which are really focused around the safe, effective, equitable use of AI in healthcare, emphasizing the need for safeguards and guardrails for any sort of clinical applications, and that's going to be a real big priority for us with the new administration in the next Congress. And I know CTA has some principles as well. So, beyond AI and privacy, does anyone want to talk a little bit about what sort of what we can expect around women's health for this new Congress, going back a little more to the women's health and maternal health side? What are some of the areas that are going to be ripe for policy action or inaction? If we can get into the mind of the Republican Congress, what are they thinking about? After they, check off or don't check off, the economy, taxes, border, what are they going to be thinking about afterwards?
Well, I'll just start by saying that Senator Cassidy, who is going to chair the Health Committee, has been a longtime friend of the Match Coalition. Luckily, there are organizations in Louisiana who have been extremely active in Match and involved over the years. So I think Match is in a really good place with regard to the incoming chairman of the committee. Cassidy is also a workhorse. And since maternal health has been important to him, I foresee good things coming out of that committee. Now, having said all that, there is the whole problem of trying to find pay-fors and reconciliation pay for tax cuts that we touched on earlier. So don't know how that's going to impact the landscape, but I think we're in good hands with Senator Cassidy.
I think there's a real opportunity for advocates the way we speak about maternal health care in this next Congress in the context of shifting the narrative to the audience on the Hill. And what I mean by that is a lot of advocates in the maternal health care space have done a great job, over the past 4 years speaking about maternal health care in the context of, equity, right, and access. And when they really drill down into equity, fantastic organizations like March of Dimes and others speak about it in the context of, racial equity, maternal morbidity, et cetera. And I think some of the opportunities lie in this next Congress in terms of shifting the narrative to things like rural equity, right? And addressing rural healthcare issues, right? When you begin to talk about racial health equity, you can potentially turn off a certain percentage of the Hill. But you can look at that Venn diagram, right? And begin to look at how do we address access to services through the rural context that will also address some of those racial inequities too. It's just really the way you talk about it, right? And I think there is a great opportunity here for the Match Coalition and others to really talk about policies, digital health, digital technology that can help increase access in rural healthcare areas, begin to address rural healthcare access, really sort of changing the vernacular from equity to access and really dropping adding the rural to the conversation, I think could, really resonate with, the congressional composition, what we have now. I think in addition to Dr. Cassidy, we'll see some other maternal health care leaders emerge. I know Katie Britt is very interested in maternal health care issues, has had some, key pieces of legislation that she's trying to push forward. And I know she's looking to champion some maternal health care causes moving forward into the next Congress. And I think it'll be interesting to see on the Republican side and the House who can be identified as sort of maternal health care champions to really, I think, allow Republicans to score some points with female voters. Obviously because they're not touching contraception, not touching abortion, those sort of issues, but really scoring points of female voters by, really looking at, maternal health care outcomes in the rural context, I think is a winning playbook for folks moving forward into this next Congress.
Yeah, I think personally, one of the things that I was thought we'd see more progress on over the last 2 years was healthcare workforce. That was one of the opportunities that Chair Sanders and Ranking Member Cassidy identified early in the 118th that never fully materialized. But I think between looking at gaps in workforce and where technology can help sort of address some of those gaps, or focusing on that workforce pipeline, it's a really good opportunity for Congress to tackle a bipartisan issue. We know that in the maternity care deserts are very prevalent throughout the country, and the worst maternal mortality and morbidity cases are in those care deserts. So I think, personally, that's one of the things that I will be looking at as a more long-term goal. But looking at that workforce piece of the puzzle. Let me pause now and see if there are any questions about anything that we've covered or anything that we haven't quite covered yet. And feel free to either put in the chat or take yourself off mute.
Well, David, as you're surfing the chat window there, I would love to throw out a question, just kind of piggybacking really on what Ariel had mentioned. And I'm wondering in terms of other areas, for example, Veterans Affairs and military. What is the panel's perspective on opportunities that you might see? While on the one end, yes, these looking for tax cutting opportunities, what other areas, for example, within military, as an example, or Veterans Affairs, do you potentially see an opportunity for either a continuation of what we've already witnessed, or perhaps, the further investments into maternal health and well-being for those populations?
Yeah, I think there's a great opportunity there. I sort of kicked off my initial comments in terms of what I thought were some wins as related to maternal mental health care in this past Congress. I know there's been a concerted effort by maternal health and maternal mental health advocates to put legislation to create funding and programs to help support military moms and caregivers and their spouses. And I think that is an effort that we will continue to see moving forward, into this next Congress. There's definitely some opportunity there for sure. There's some good organizations pushing. They try to get some language in this NDAA. The funding was stripped from it, but it is sort of folks are on notice now that there are advocacy organizations pushing forward for supporting military moms from both the maternal health and maternal mental health aspect that is very much needed.
Yeah, that was a great answer. Don't have much to add on that.
Does look like we have one question, David.
Jay, do you want to ask it, or do you want me to just read it?
I can ask it if you'd like,
Sure.
or
Yeah, please.
whichever is easier. And I just want to thank you all so much. This is obviously a lot to process, and I know we've all been, needing that crystal ball. And so this is the next best thing in terms of getting your expertise to weigh in on, trying to help us wrap our minds around what to expect and anticipate, even though there's still a lot of ambiguity. But that being said, my question really just had to do with a lot of these digital health companies that provide telemedicine, remote patient monitoring, and even hybrid models with doulas or sometimes mental health services. Right now, I know a lot of that is billable through either Medicaid or private commercial insurance. And so there is kind of that win-win-win for providers, patients, and the companies or platforms that help support and provide these services. And I just wondered if you had any insights into how that may change in any way in the future with what we're kind of dealing with in terms of continuing to support that happening, because obviously with the way it's currently, that is helping patients get services they need to tackle the maternal health and maternal mental health crisis. Thank you.
Well, I'll just jump in. I don't see an immediate change in any of there's kind of a couple of things to unpack there. One is, do we see, reimbursement for remote monitoring or telehealth going away? I don't. I think, that's kind of here to stay. The other thing to unpack there is reimbursement for things like doulas and, healthcare providers who aren't doctors, nurses, things like that. That is usually regulated at a state level. So I don't have an insight into that per se. But I don't see anything, how I should answer this. I don't see anything in the election impacting the reimbursement for remote monitoring, telehealth, or anything around like third-party care providers.
Yeah, I agree. As Catherine, as you mentioned in the beginning, telehealth, remote patient monitoring, just digital health generally, it was starting to get a lot more traction even before the COVID-19 pandemic with President Trump and his administration. RPM was not a benefit for Medicare patients until 2018 or 2019, the fee schedule there. And since then, we've seen a lot of progress, whether it's RPM, remote therapeutic monitoring, digital therapeutics, the embracing of technology in healthcare has really just taken off, and I don't see that going away anytime soon, especially talking about AI. So, I think how it's covered, how it's regulated, I think that will matter to this next administration, how we phrase it. But I think, to quote Seema Verma, the genie's out of the bottle. It's kind of here to stay broadly, not just with telehealth, but digital health generally. I think we're seeing a lot more advancements in, collecting data, whether it's in the healthcare or the public health side, the use of data and leveraging data. I think this is all going to, it's continuing to trend upward. So I'm very optimistic about that side of things. Yeah, thanks for the
Thank you
question.
so much. Very encouraging.
I love that distinction that you all drew on state versus federal, which sometimes we often forget, that there's so much, in fact, that quite frankly is at a local level. It's at a state level. They're not necessarily, obviously funding helps, but how the states take that funding and how they allocate it and the further policies that they're able to drive are really at the state level. We tend to overlook that sometimes. Do you foresee that there's going to be a continuation of more power being given back to the states on many of the topics that relate to, maternal applications of technology and privacy and security and things of that nature?
Well, go please.
No, go ahead, please.
I was just going to say very quickly, I think whether it's a directly ceding power or by a lack of inaction, states sort of taking up the charge and leading it for themselves, I think we will see that, especially on the privacy space, and the AI space.
Yeah, I think you're seeing that in like California, for example, they sort of view themselves as the lead of their resistance, right? In terms of what's coming in terms of the Trump administration and being able to pass proactive, pieces of legislation. We've seen it, them try to do in AI, and data privacy and others. And as many people say, as California goes, so do other states. So I think there may be a trend, exactly to David's point, whether it's inaction or proactively taking steps to address things to preempt federal government decisions. Definitely will be happening in the states in the next couple of years.
Well, sitting in California, I would say if that were the case, then Jade, the answer is yes to some of the things that you were raising questions on, because we are certainly putting forth the funding on all of those. David, I'm just noticing that William actually had a question. He was posing, do you see any development of legislation that promotes AI to the extent of past legislation did for EMR adoption?
No, I don't think we'll see a meaningful use for AI. No, especially not in a Republican administration. But kind of pivoting off there, you've got, AI is not a monolith. We say that at CTL all the time. There's different use cases. So when you're talking about AI and the administrative standpoint, a lot of that is already kind of built into the EHR, or integrates with the EHR. And then you have AI that is software as a medical device or delivering a service. In theory, that should be reimbursed through CMS. However, CMS really struggles, as we all know, with how they calculate and pay for software as a medical device or software that isn't like your typical EHR billing system. And so we've been at CTA talking with Congress, congressional leaders and how we can encourage, because CMS keeps saying, like, we know we need to do something about AI and software as a medical device. It's not great. We are hopeful that we would see something in the Medicare physician fee schedule proposed rule this year, but we did not. And so I think we are looking for ways to continue to push CMS to address this issue, whether that be commenting with CMS, meeting with CMS, or there is actually a congressional letter that went up in November, I believe, raising this issue of, like, CMS, get your act together. We've got to address this. There's only more AI tools coming on the market, and just generally software as a medical device. So I think those are kind of like the two pathways, but no, I don't see any large incentive structure.
Yeah.
Catherine, you left us with she left us with something I wanted to deep dive on, and then I looked at the time. I'm like, oh, we're out of time. Because if you can just tell us in 30 seconds or less, what was it that you were looking for? What is it that the CTA is looking for, or that might recommend that we should be looking for in that language? What's the language we're looking for?
Yeah, well, 30 seconds or less. It's kind of a complicated issue of, like, how CMS gets to the level of payment on certain services, right? It goes to the physician's input, so how much work it requires on the physician side, and then you've got, like, this practice expense portion of it too that goes into the equation, and that's usually, like, the software issue. But when AI is taking away the physician's work, then that is a hard equation to kind of come up with a good reimbursement level for an AI service. So we're looking for language in CMS regulations that addresses how they are going to adapt their reimbursement calculations for software as a medical device and AI.
Yes,
specifically.
I agree with David's remark. We need to drill deeper on this one, and you've hit on some. I mean, for our space, we would consider this kind of controversial because what you're talking, like, comparison of reimbursements for physician versus AI, a war between the two. Like, we've already seen this kind of coming up and bubbling up.
Yeah, well,
But-
so to be clear, in the Medicare program, only physicians can be reimbursed. So we're talking about reimbursing physicians for their use of AI.
Okay. Yeah. Let's go deeper.
Technology companies
Let's
can't be
make it
reimbursed
fun.
with Medicare.
Let's make it as a post CES recap in February.
Yeah.
Yeah, let's do it. Let's do that. And let's bring some of the tech companies, like Sarah is with Baby Scripts, and there's many others. Yes, let's bring them all. Let's bring some of the tech companies in, and let's do that. Let's go a little deeper and talk about the reimbursements. This is good stuff, folks. I am always thrilled by and amazed by these programs. They just keep getting better and better. We knew it was going to be outstanding, but I just had no idea how outstanding today would be. I'd like to thank Elizabeth, David, Catherine, Ariel, as well as Kelsey, and all of you for participating today. This has been absolutely outstanding. I think it's the best way ever to, celebrate and acknowledge all that has been accomplished in 2024. And to really keep a glass half full on 2025. Thank you all so much. Have a happy and joyous holiday season, and we'll see you in the new year. Take care, everybody.
Thank you, everyone.
Bye.
Thank you.
Happy New Year.
Happy New Year.
Happy New Year. Wow, that was super fun. I gotta stop the recording.